Information about the plans here in Massachusetts to get COVID-19 shots to children ages 5 to 11. And local pediatricians are hearing from parents trying to sign up their kids.
Those shots could start going out in early November once given the green light. Western Mass News reporter Briseida Landaverde joins us live now with more. Briseida.
Yeah, well, Chris and Jordan, we asked parents at home how they feel about the vaccine, and they've been voting in an online poll. So far, over 31% of parents said they would get their children vaccinated right away. 10% said they would wait and see how it rolls out. 51% said they are not interested, and 6% said they are not sure just yet. Now, we did speak to a Springfield parent today who says she will be getting her 11-year-old daughter vaccinated. Yaritza Bruno, a mom of two, is awaiting approval of the COVID-19 vaccine for her 11-year-old daughter. She says, I feel like they are more protected against the virus. Her 13-year-old son has already received the shots.
She just told me to get it for school and sports and stuff like that.
On Wednesday, the White House unveiled its plan to roll out the COVID-19 vaccine for children ages 5 to 11, this pending emergency use authorization by the Food and Drug Administration and if the Centers for Disease Control and Prevention signs off. But planning across Western Mass is already underway.
So we're in the process of contacting the state where we get our vaccines from and figuring out the process of how to accomplish that.
Dr. John Kelly, a pediatrician at Redwood Pediatric and Adolescent Medicine in East Longmeadow, tells Western Mass News parents have already asked to be put on a waiting list.
Just in 2 days, I easily compiled a list of over 10 names.
Under the White House's rollout plan, the vaccine will be offered in 25,000 pediatric and primary care offices, as well as pharmacies and clinics. President Joe Biden's administration says it secured enough doses to vaccinate 28 million 5 to 11-year-olds. Western Mass News is getting answers on how children's doses will differ from those administered on adults.
The adult dose of the vaccine is 30 micrograms, and the children's dose, as I understand it, will be 10 micrograms.
Dr. Kelly says packaging and storage will also be different.
It's going to be packaged in a slightly smaller vial. It's going to be different, color-coded differently so that it can decrease any confusion between the children's dose and the adult dose. And they'll keep in a standard vaccine refrigerator for 10 weeks. So we don't have to keep it at the ultra-low temperatures.
Now, earlier today, the State Health and Human Services Secretary Mary Lou Sudders provided more information regarding the rollout process here in the Bay State. Now, she says 515,000 children ages 5 to 11 will become eligible for the pediatric vaccine. The state is expecting an initial shipment of 330,000 doses arriving sometime between October 26th and November 5th. Meantime, emergency authorization is expected the first week of November. Now, Sudders says more information is expected next week, so of course we will keep you updated both on air and online. For now, reporting for Western Mass News, Briseida Landaverde.